Good evening. I hope you can hear me. Please just let me know, make sure. All right, I'd like to welcome you to our next webinar. I am your host again. My name is Caroline. And this time, of course, we're going to hear a little bit about the process of selecting a clinic for your IVF treatment abroad. I am sure that at least some of you have been struggling with finding a suitable clinic. And I hope that today you will find out some more details on how to do that, what to look for when selecting a clinic, etc. The presentation will be conducted by Dr. Laura García de Miguel, who is the medical director of Clínica Tambre, located in Madrid. And of course, again, let me remind you that the presentation will take 20 to 30 minutes, and our Q&A session will start after that. Remember that you can type in all of your questions in that chat section. You can do that during the presentation and of course after the presentation. And again, I would like to remind you that the webinar is being recorded, so if you have any connection issues, etc., or you would like to rewatch it again, you will be able to do so later on. And I believe it is time for our presentation to start. Dr. Laura, can we begin?
Hello, Caroline. Good evening, everybody. First of all, I would like to thank Egg Donation Friends for this webinar. As Caroline already said, I'm Dr. Laura Garcia. I'm the Medical Director on Clínica Tambre in Madrid. Today, I will speak about how to choose the right clinic. My presentation is divided into 6 parts: the experience of the clinic, the laboratory team and equipment, the donation program, the results of the treatments, the need to have a multidisciplinary team to assess every patient in an individual way, and to conclude, the patient care department. Let's start with the experience section. It is very important to choose a clinic with a broad experience in assisted reproductive treatments, having done many treatments over the years. Concerning the doctors of the clinic, they should be gynecologists with specific training in reproductive techniques, with at least 5 to 10 years of experience and a master's degree in human reproduction. Also, it is very important to check that the embryologists working in that clinic have an European certification from ESHRE, the European Society, and a master degree. Moreover, you should check that the clinic has weekly medical meetings and that scientific research is done. Also, it is important that the team attends frequently to meetings and congresses to keep up to date. Now, let's talk about the lab. The most interesting aspect is the quality certificates. Not only the international ISO 9001, but also other certificates are necessary. Also, the lab tip is relevant. You should confirm that the number of embryologists is appropriate for the amount of cycles. As I already said, embryologists should have an European certificate from ESHRE. Deep knowledge on blastocyst biopsy and genetics is a must. I would like to highlight the particular technologies in the lab: the safety, the blastoculture, the time-lapse incubator, the pre-implantation genetic diagnosis program, and the sperm selection technologies. To start with the safety, I recommend to choose a clinic that has a double checking system, which means that 2 embryologists will check every step of the process in the lab. Also, to increase the security, the witness system, for instance, allows us to prevent potential errors by using a personal card with a barcode for each patient. To continue with the blastocyst culture, we always recommend to get the embryos to the blastose stage and avoid day 2 and day 3 transfers. This allows us to transfer single embryos and to avoid multiple pregnancy with its particular risk, most of all, prematurity. Furthermore, the best clinics have time-lapse incubators allowing an uninterrupted culture of the embryos with constant factors such as temperature, gas, light, as well as a continuous image recording. It has been observed that a higher rate of embryos reach the blastocyst stage when using time-lapse incubator compared to the conventional ones. Moreover, another important aspect in the lab is the preimplantation genetic diagnosis. You should always choose a clinic that carries out the biopsy on day 5 embryos. It is also important to do this procedure with the most innovative laser. The results of the genetic study should always be carried out using next-generation sequencing technology and with the possibility of having the results in 24 hours if needed. The preimplantational genetic diagnosis can be indicated either to prevent the transmission of genetic diseases as well as to avoid miscarriages or treatment failures caused by chromosomal abnormalities. Finally, if you're going to do the treatment with your partner's sperm and it has not a good quality, or you have had previous failures, the clinic should count on specific tests for the sperm such as gamet, chromosperm, and fish. Depending on these tests, techniques such as the chip time, sperm flow, or max should be undertaken to improve your success rate. To move on, I will talk about a particularly interesting topic, which is the donation program. If you're planning to use a sperm or eggs from a donor, the clinic should have its own bank. It is also very important that all the donors have a wide variety of medical, psychological, and genetic tests done, such as karyotype. I would like to emphasize the convenience of having the DNA of your donor storage with no time limits, just in case you need to study it in the future. Also, you should always check that the clinic offers the possibility of doing a wider genetic matching. This consists in checking in a blood test the carrier status of more than 300 recessive diseases for both your partner and the egg donor. This study can also be done with sperm donor and even in treatments with own eggs and partner sperm. In egg donors in particular, it is advisable that nurses of the clinic administer the medication to prevent any potential mistake. Also, you should avoid clinics that hyperstimulate the donors to show the eggs among many patients. It is also very interesting to choose a clinic that offers the possibility of choosing between fresh and frozen eggs with total transparency. And now, let's move to the success rates part. The results must be audited by a third-party entity and reported to the Fertility Society. For instance, regarding the IVF treatment, it is important to avoid hyperstimulation syndrome. You should always avoid clinics that favor the transfer of more than one embryo. This can lead to multiple pregnancy that will worsen perinatal results. Also, you should ask for an individual prognosis based on your characteristics and test results. In general, success rate of IVF should be above 40% and above 60% if PGS is carried out and a healthy embryo is transferred. Concerning egg donation, I recommend you to choose a clinic that only carries out transfer of single blastocysts with at least 65% success rate per transfer. It would be also interesting to know the cumulative pregnancy rate of the clinic in a complete egg donation cycle. The best professional clinics should guarantee at least one good quality blastocyst. That means a blasto with at least a 3-4 expansion rate and an A or B grade either for the inner cell mass and the trophectoderm. These good quality blastocysts have higher possibilities of implantation. Also, if thawing is needed, these top quality blastos will have survival rates near 100% and the success rates after cryotransfer similar to fresh transfer. In the fifth part of the presentation, we're going to talk about the importance of having a multidisciplinary team in the clinic you choose. You should not only check that all the treatments are done, including embryo adoption, but also that specific units are available, such as urologist, in case testicular biopsy is needed, psychologist, if you need some help to deal with this process, surgery units capable of doing hysteroscopy and laparoscopy if needed, and the immunologist unit. In particular, the implantation failure and recurrent pregnancy loss unit plays an important role in women with poor prognosis. This kind of unit will focus on endometrium studies such as the receptivity biopsy test, immunological and hematological studies to prevent failures due to incompatibility and other pathologies, as well as genetic causes in the embryo or the gametes. To finish with this presentation, let's talk about the patient care department, which can help you to handle with the non-medical aspects of this process. You should always choose a clinic with the airport pickup service, with a location easy to reach. Help with the trip organization, as for instance, hotel booking is desirable. And other facilities to take into account could be individual waiting rooms, and individual bedrooms to stay comfortably after every procedure in the clinic. In treatments such as the ones we're talking about, the availability is a very important aspect. You should choose a clinic that offers you different ways of contact, such as Skype, telephone, mail, or WhatsApp, and a continuing attention 24 hours, 7 days per week. It is important to have fluent communication in your own language with the medical team in order to fully understand all the steps of the treatment. Not only this, but also to count on human approach will ease your path to pregnancy. To sum up this presentation, I would like to highlight the most important aspects you should focus on when choosing the clinic. Without any doubt, you should choose a clinic that offers your individual prognosis and avoid clinics that overpromise pregnancy rates. Without any doubt, you should choose a clinic that offers your individual prognosis and avoid clinics that overpromise pregnancy rates. Of course, you should only choose clinics with the quality certification achieved. I strongly recommend a clinic that offers an individual medical follow-up. With no doubt, I will choose a clinic with the most innovative technology, as I explained before. I will not recommend you to trust the clinics that use external donors from external banks. Also, you should avoid clinics that promote transfer of more than one embryo to improve their success rates, because this will risk your safety and the one of your baby. And also choose a clinic that allows genetic studies and avoid clinics that do not offer this possibility. Thank you very much for your time, and I hope you enjoyed my presentation.
Thank you, Dr. Laura, for explaining the whole process of selecting clinic for us. I'm sure some of us at least had some, answers to the questions, and I guess we can move on to our Q&A session. Let me have a look if we have any questions already. I don't see any yet, but of course, if you have any questions, please just type them in. I can see someone is writing already, so let's wait and have a look. Yes, okay, Alice is typing now. Let's have a moment then. I am sure you have lots of questions regarding the process of selecting clinic, but if you have any other questions regarding the egg donation process, etc., I am sure Dr. Laura will be able to assist as well. Okay, I do see first question, so let's go for that. Okay, why do you advise against multiple implantation?
Okay, so thank you for your question. So this is a topic usually we need to handle with our patients, because usually many patients prefer to transfer more than one embryo. So our objective is to have a healthy baby and a healthy mother after the delivery. if we transfer more than one embryo, you should know that embryos can divide itself. So, for instance, if I transfer to blastocyst, we could have a pregnancy of 2 babies, but also there is a little possibility of having a pregnancy of 3 and even 4 babies. So let's imagine if we have a pregnancy of 2 or 3, we will have higher risk of having some pathologies such as problems of hypertension and preeclampsia, and this will normally lead in prematurity deliveries. And prematurity deliveries under 28 weeks can lead to very important chronic problems for the children.
All right, thank you, Dr. Laura, for explaining that. I do see we have another question, so let's have a look. This time from Kate. What is the difference in using fresh or frozen eggs when using donor eggs?
Thank you very much, Kate, for your question. The main difference is if frozen eggs are used, we need to handle with a higher number of eggs because we need to do the thawing. So in terms of results, there is no big difference, okay? But we should count on more number of oocytes if the cycle is realized with frozen eggs. For instance, in our clinic, we recommend to use fresh donor if there is not a need to plan the transfer in a particular date. But when plan is needed because, problems of organization, the job, whatever, then it's most convenient to do it with frozen eggs that can allows us to program all the cycle in terms of calendar.
All right, thank you for that. Let me have another look at the questions. Yeah, here it is. It's from Erin this time. What is hyperstimulation syndrome, please?
Thank you very much, Erin. This is a syndrome that can appear after the in vitro process, which means when we are stimulating with the subcutaneous hormones, if the estradiol level rises more than 3,000 and we obtain more than 15 eggs, then there is a risk of having an hyperstimulation syndrome, which means that the liquid of your body is going to go through the third space, which means in the abdominal area and other areas. So this is a very important issue to avoid because there's no need to be that risky. So we recommend to do normal stimulations, which means not very high dose, no more than 300. And then no matter if the estradiol or the eggs is very high, then we should freeze all the embryos and prevent that syndrome by programming a cryotransfer in the next cycle.
Okay, perfect. Thank you for explaining that. And let's move on to the next question. Could you let us know what is the percentage of good clinics in Spain with your criteria?
Thank you very much for that interesting question. I really don't know, what is the criteria of the other clinics in Spain. I would say that Spain is a country with a long experience in this type of treatments, with a long experience. But I cannot say that 100% of our clinics are, working with these high standards. So I guess perhaps, I don't know, 50% 75% maximum would go with this criteria, but not all the clinics.
All right, thank you. And let's have another question. How can we get information about the laboratory? Can we simply ask the clinic?
Thank you very much for this question. I guess you can directly ask to, the patient care department or directly to the gynecologist and to ask for, details about the lab, and they would just, answer all your questions.
Perfect. Thank you for explaining that to us as well. And let's check another question. Do you advise clinic that offers embryo adoption?
Yes, we do embryo adoption, and it is a normal practice. Not all the clinics are realizing that, technique, but we're offering this technique.
Okay, perfect. Thank you. From Sabine this time, what does the open donor 18 plus means, which I saw on your site?
Thank you, Sabine, for your question. This means that our law, the Spanish law, allows us to stimulate, to choose donors between the 18 years and maximum 35 years old. So in general terms, our donors will be around the 20s.
Okay, thank you. And from Erin, why do 50% of embryos not make it past day 3? Is this due to poor quality sperm or a problem with the egg?
Thank you, Erin, for this interesting question. This is, a percentage in the general of the human development. It's not a problem regarding the techniques. It's not a problem regarding the sperm. It's, the general rate of all the embryos, of all the human embryos, no matter if it is in the natural cycle, in the sexual report, or in, the laboratory techniques. So it's a question that the embryo is a particular, very important, I don't know how to say it. It's very important in the beginning and has a very little number of cells, so not all the embryos would arrive to the blastocyst stage.
Okay, perfect. Thank you for this. And let's take a look at another question. Can we trust clinics that offer guarantee programs? For example, they say if you get back 80% of the money if the pregnancy is not achieved.
Thank you very much. As for your question, I would say yes, you can trust on these clinics, but the problem is that in general, not all the patients can, apply for this guarantee. Only the good prognosis patients can enter in this program. So then, this good prognosis patient don't need to pay that this big amount of money. By contrast, the poor prognosis patients will not be accepted in these guarantee programs, and then it's not worth it.
Okay, perfect. Thank you. And let's see, have another question from Doris. Why most of the clinics, I would say 99%, provide information about success rates as pregnancy per transfer? I mean the IVF with own eggs program and not the pregnancy per cycle, or it will be better show live birth per cycle.
Thank you very much, Doris, for this interesting question. I agree with you. I totally agree with you The problem is, sometimes the follow-up of these patients. In Clínica Tambre, we usually do a very individual control of our patients, and we call back them if, of course, they are in another countries, when the pregnancy test must be realized, and then we do a follow-up during, all the pregnancy in the first 3 months, in the 20 weeks, and also after the delivery. The problem is that sometimes there is patients that do not answer to our questions or do not answer to our emails. So we cannot do data about the delivery rates. I would say that you should decrease at least 10% of the rate that the clinics are offering, at least 10 to 15% of the live birth per cycle.
Okay, perfect. Thank you for explaining that. This is a very interesting question for sure. And let's see, we have another question. Yes. Is there a difference in success in using fresh embryos against frozen embryos?
Thank you very much, Zach, for your question. As I said during my presentation, regarding blastocyst embryos, which means that they are embryos that have arrived day 5, and they are good quality embryos, it may not be a huge difference between fresh and frozen, and I would say fresh embryos transfer on day 5 would be around 65%, and then frozen embryos, the most important aspect is the thawing, but if they correctly survive thawing, then the pregnancy rate can decrease 5 to 10%, but that's it. So we have many patients, to be honest, that are achieved pregnancy with the cryo transfer, but not with the fresh transfer. So it's more or less the same pregnancy rate.
Okay, perfect. Thank you for that as well. And let's move on to the next question. Can I import frozen donor eggs from South Africa? They offer pictures of donors as a child. It's still anonymous.
Thank you very much, Thurston, for this question. I would say that donors that works in our clinics or in Spain, they need to be with the Spanish laws characteristics. So you cannot have a picture of your donor. So I'm sorry, but this cannot be accepted.
Okay, thank you for explaining this as well. And we have another question from Tina. Why is it better to use day 5 egg than day 3?
Thank you very much, Tina. In general, it is already confirmed that day 5 embryos have a higher implantation rate compared to day 3 embryos. Of course, it is nearly impossible to check this little difference because the main embryo cannot be transferred 2 times. I mean, day 3 and then day 5 to check which strategy is the better. The problem is what I already said is that the 50% of the human embryos do not continue the division and the process of embryo evolution at day 4 or even at day 5. So it is not worth it to do day 3 transfers because we cannot confirm that this is evolutive embryo.
Okay, perfect. Thank you. And we have another question from Erin. If using an egg donor, what is the expected number of eggs that will be collected?
So if we do a normal stimulation and not a high doses stimulation, I would say something around 10 to 12 eggs. But then we should count on the number of mature eggs. So in general, between 8 to 12 mature eggs can be, collected.
Okay, perfect. Thank you for this. And from Tara this time, I want a 2 embryo transfer and I'm wondering if clinic will do this if requested.
Thank you very much, Tara. Of course, we cannot deny your, desire of 2 embryo transfers. We have an ethical committee just in case we should discuss about the convenience or not of an individual case. But if you do not have any particular problem, like, I don't know, more than, maternal, advanced age, or 2CS section, whatever, then of course we can accept the 2 embryo transfer after discussing with you why we always recommend the single embryo transfer.
Okay, thank you. We have another question from Doris. What would you recommend if, for example, I have 2 embryos, really poor quality, on day 3? Would you recommend to transfer them on day 3 or wait till day 5? However, probably there will be no embryos on day 5, so I will end up without a transfer. What are the ups and downs in such a situation? Is it better to transfer embryos on day 3 or wait till day 5?
Thank you very much, Doris, for your particular question. So I really believe that it is better to go for the blaster culture and to leave these 2 embryos you have on day 3 to let them in culture till day 5. Then you will really check if you have at least 1 embryo to transfer of good quality. But if you do not have any embryo to transfer, at least you will not have, the pregnancy wait for the result, and then you should understand why you would have had a failure. So many patients ask, and they are worried about what this, the problem about canceling their transfers when leaving the embryos till day 5. But my concern, it is very important to transfer only the appropriate embryos and not to do just, embryo transfers, because the most important is to have the healthy babies and not to lose time on transfers that are not going to be successful.
Okay, perfect. Thank you. And for Maria, how do you test the egg donor 1, for example? I know the sperm can be checked by multiple tests.
Thank you very much, Maria. So first, before accepting the donors in the clinic, we do, as I already said, medical, psychological, and genetic tests. So from all the donors, we do not accept more than 20%. Okay. So to begin with, we start with the gynecological test, and we ask the donors if they have had any problems regarding fertility, if they have their own children. Then we do a personal interview, and also we do ultrasound and hormone profile like AMH, and in the ultrasound the follicle antral count to check that they have normal ovarian reserve. Then we continue with serologies. Then we continue with the genetic test if needed. But of course, it's when after we have realized the simulation that we can check the quality while it is, using in the laboratory. So not only for the donors, but also for the, own eggs. The quality of the egg can only be studied because of the age. So that's the reason why we cannot accept more than 35 years old. But the second possibility, the only other possibility is to study directly during the laboratory.
Okay, thank you. And we have another one from Sabine. What is the law in Spain regarding donor sperm? What about if the child, when 18 years old, would like to meet her father? Is that possible?
Thank you very much, Sabine. So I'm sorry, but the Spain law cannot accept this. So only there would be two situations that can, accept to meet the father. So this is if the medical reason, if the medical reason in the baby needs for a particular donation of the donor, then this can be accepted. But if no, it's not possible.
Okay, perfect. Thank you. We have another one from Sandra. Do you offer eggs from donors with proven fertility, donors that already have their own children?
Yes, thank you very much, Sandra. Of course, we have donors with proven fertility and also can be requested.
Okay, perfect. Thank you. Does your clinic offer Skype consultation? If so, how much does it cost?
Thank you very much for your question. Yes, we do a Skype consultation, and for the moment, it is free.
Okay, thank you. From Sandra, we have another question. Do you offer family planning with egg donation, more embryos from the same donor to have more chances to have children from the same donor?
Thank you very much, Sandra. Yes, we do offer family planning. So, for instance, we have a possibility of having a guarantee of more than 3 blastocysts. So this can, go for the family planning.
Okay, thank you. And from Erin, what information is the recipient given about the egg donor? Which team member is responsible for matching egg donor and the recipient?
So the information that the Spanish law let us to give you, it's the age, the blood group, and then if general characteristics are requested, we can offer the color of eyes, color of head, etc. General characteristics. Regarding the matching egg donor and the recipient, I understand you're asking which part of our team. We have a coordinator of the egg donor, and it is realized by the gynecologist itself.
Okay, perfect. Thank you. And what is the success rate of embryo adoption? If I want to choose this treatment, what should I consider?
Thank you very much for your question. Regarding the embryo adoption, it is around 45 till 50% more or less of pregnancy rate. What it is more important, it is to consider also if you can ask for blastocyst stage, because many embryos in our banks are on the 2 or day 3 embryos. So not all the clinics have blastocysts to do the embryo adoption.
Okay, thank you. And let's move on to the next question from Irfan. How do we know the embryos are of good quality or not in clinics without time-lapse incubator?
Thank you very much, Irfan, for your question. So also in the traditional incubators, before transferring on day 5, if it is a blastocyst, or no matter if it is a day 3, before transferring, the biologist needs to classify the category of that embryo, and then it should be into account in the report. So you should be informed about the quality of your embryo.
Okay, thank you. Let me check the next question for you. Okay. Do you recommend a clinic that guarantees only a specific number of mature eggs and not any blastocysts?
So this is also an important also aspect to consider, but the most important is the guarantee of blastocysts, because no matter the number of mature eggs that they are going to give you, but sometimes there are donors that can respond with medication with more than 15 eggs, but then the quality of these eggs and the quality of the embryos cannot achieve the blastocyst stage. So I will consider more the blastocyst guarantee than the number of mature eggs. So the number of mature eggs is more a problem for the clinic, but not for the patient. By contrast, your more important objective is to have blastocysts of good quality to transfer. Depending on your personal situation, you would go for a 1 blastocyst guarantee or even 2 or 3 blastocyst guarantee, but this is my recommendation.
Okay, perfect. Thank you for clarifying that for us. And we have another question from Sandra. Why some of the embryos on day 5 that seem to be good blastocysts with some fragmentation do not make it to be transferred or frozen because they did not remove the fragmented material? Are these errors caused by low sperm quality, egg, or something else?
Thank you very much, Sandra, for your question. So if a good blastocyst has a lot of fragmentation, then it is not considered a very, a top blastocyst. Regarding fragmentation on the embryo development, it can be caused by either oocyte or sperm abnormalities. So depending on the cycle results, we should recommend to go for extra studies if the partner sperm is, used, or perhaps the problem of the donor, because of course not all the donors achieve the highest qualities on the blastocyst stage.
Okay, perfect. Thank you. And let's see, we have another question from Mercy this time. Can your clinic assist in exporting of semen from UK if husband is not able to travel to Spain?
Thank you very much, Mercy. Yes, we do accept this kind of exportation. There's no problem. If the husband cannot, travel to our clinic, we can of course export and do the treatment in our clinic.
Okay, perfect. Thank you. And from Sandra, we had a perfect embryo with egg donation transfer to a perfect endometrium, very good sperm quality, and all tests and hormones were okay. Nonetheless, it did not end up with a pregnancy. What are other options and where to look for the causes?
Thank you very much, Sandra. As I already said, if, I don't know if you had only one or either two failures of perfect embryos on day 5, then we should focus on a three-dimensional study regarding the endometrial receptivity and also endometrium tests to study if there is a risk of infection inside the endometrium. Also, I would recommend the need to do the PGS, to study the embryo before transferring and to confirm if it is an euploid embryo or not. And the third point is to study all the immunological and hematological system that can interfere in the implantation.
Okay, thank you. And let's check another question from Maria. So what test do you do in the laboratory on the egg?
Thank you very much, Maria. The problem is that we cannot do any test in our laboratory or other laboratories before using that egg in the laboratory, because if we're going to test it, we cannot continue working with the egg because it's going to die. So we can only accumulate and confirm if it's mature oocyte to continue with the process. But we cannot do genetic tests directly to the oocyte, because if we're performing this kind of study, then the egg cannot continue with the development.
Okay, thank you for explaining that. And we have another question. If a child is born from egg donation and the child is diagnosed with genetic sickness, can we get more information from the donor if needed for the treatment of the child?
Thank you very much for your question. Yes, right, that's what I already said. We are one of the clinics that are storing the DNA without time limit. So this is very important, because in the future, if your baby has a problem, then extra tests can be realized on your donor. So this can give extra information to the doctors to check if it is a genetic disease coming from donor or not.
Okay, perfect. Thank you again for clarifying that for us. I do see we have another question from Nicola this time. I have had 8 own egg IVF cycles. One of those resulted in a positive but ended in miscarriage. I am now 43 and considering using donor eggs. Should I have any other tests before moving to donor? I have had ERA procedure, thrombophilia test, no issues, and basic immune test. NK blood tests, cytokines, etc. and no issues. Also no issues with sperm, DNA fragmentation was very low. Just wondered if I should have any other tests before spending money on donor cycle.
Thank you very much, Nicola. It depends on your particular case. If the miscarriage was under 38 years old, I would, study all the immunological and hematological situations that can lead to a miscarriage. But by contrast, if the miscarriage was with more than 38 years old, as the main cause is the chromosomal abnormalities, I would not go for extra tests, and directly you can go for the donor, for the egg donation program.
Okay, perfect. Thank you. Let's see, we have another question from Sandra. What is the maximum number of guaranteed good quality blastocysts you offer from one donor? This is for the family planning.
Thank you very much, Sandra. our higher guarantee is 3 blastocysts, because we understand there are other clinics that are including guarantees with more blastocysts, but the problem is that you cannot guarantee with the same donor. So we understand, this is biology, and we cannot guarantee more than 3 blastocysts. So this is minimum blastocyst guarantee. It can lead 4, 5 to 6, blastocysts, but we do not work with higher blastocyst guarantees.
Okay, thank you. And from Erin, did you say the gynecologist chooses the egg donor for the recipient?
Thank you very much, Erin. Right, this is the gynecologist, here in our clinic that choose the donor for the recipient. So we ask in the specific consent for the egg donation to fill in with your characteristics, and also if you can send a photo, because we have innovative technology to match your photo with the photo of the possible donors. And this technology, it's an informatical technology, will give us the percentage of similarity between your face and the face of the donor. So we do with both systems. I mean, with the first, it's the gynecologist with this, choosing the donor, and with this new application that can match your photographs.
Okay, thank you. And let's take a look at this question from Ilona. I heard that the window when embryo can attach to uterus is limited period. How do you calculate the optimal day of pore transfer in blastocysts?
Thank you very much, Ilona. So the majority of the patients have the window on day 5 to day 6. So usually after 5 to 6 days of progesterone, so usually 5 days of progesterone, we will go for the transfer. But if 2 failures are, we have 2 failures, then the endometrium test, the endometrium receptivity test is realized to check if the window is, transfer and it's on day 7, for instance, day 7, or even on day 4.
Okay, perfect. Thank you for answering that. And let's move on to the next question from Alice. What are your thoughts on using acupuncture, Chinese herbs to support IVF?
Thank you very much, Alice. I understand there are some reports that some studies that with the acupuncture and extra treatments, we can increase the pregnancy rates. So if the person, if the patient, is accepting this kind of treatments, I will recommend. By contrast, I have no much good feeling with the Chinese herbs, because sometimes this kind of herbs, I mean not all of course, but some of them can lead to miscarriage. So yes for acupuncture, no for Chinese herbs.
All right, thank you for clarifying that. It's very interesting, I'd say. We have another, okay, that's interesting. Can I have a Skype consultation with you from my?
Yes. Thank you very much. Yes, I guess you can go directly to the egg donation platform, right, Caroline?
Yes, of course, and we can forward your request to the doctor, and we will, and of course, the team will get back to you. Okay. Perfect. And let's see.
I will be very happy to answer all the specific questions by Skype.
Yes, of course. Anyone, if you would like to, you have any other questions, of course, you will be able to get back to us. You can get back to us via patient@eggdonationfriends.com, and we will be able to forward your questions. And now let's have a look at next question from Sandra. With $17 eggs, we ended up with 2 top quality blastocysts. What is your opinion on these results, and what recommendation would you give? Is it a standard result?
Thank you very much, Sandra. So, in general, every 3 to 4 oocytes would achieve the blastocyst stage. So, for instance, in a normal stimulation, in a standard donor response that can lead in, for instance, 9 eggs, we would arrive 2 or 3 blastocysts. And in general, in the donor program, if there are no extra problems like the sperm factor, then at least the 75% of the blastocysts should be of good quality. So I would say with 17 eggs, it's not a very interesting cycle if you achieve 2 quality blastocysts. So perhaps the donor had, I don't know, sometimes what I can say, it's a ovarian, it's a type of ovary, the responses in higher number, but then the quality is not that convenient. So I cannot, 100% say, but perhaps this is not the most quality donors.
Okay, thank you. And let's have a look at the next question from Sabine. Would you recommend to have an endometrial receptivity test to find the best time for implantation? Do you also offer that?
Thank you, Sabine, again for your question. Yes, we offer in our clinic these tests. So you just can do it in the routine way, before the first transfer. But what we do recommend is after 2 failures, of course, you should do and check the endometrial receptivity. But of course, there are patients that no matter if they do not have failures, if they are going for the first embryo transfer, they really want to check the endometrial receptivity, and of course, we can accept this procedure.
Okay, thank you. And from Sandra, do you use for donor matching only the photos and characteristics of the female recipient, or also some characteristics of the male partner?
Thank you very much, Sandra, again for your question. Yes, in the consent, if the egg donor treatment is done for a couple, we ask for the two, for the recipient and also the male partner, or if in case 2 women, so 2 women. But regarding our law, we should just take into account the female recipient characteristics. So to be honest, I can only, match with the female recipient.
Okay, thank you. And let me have a look. We have another question from Sandra. Is the ER test result good for the following cycles? Does it say always the same, or does it show only the situation on the one tested cycle?
Thank you very much, Sandra. And the data that these tests are in the studies, they show that it is similar, the response in the consecutive cycles. So if you do an endometrium receptivity test and the window is okay, which means that you can transfer on the same day with the same protocol. So this is very important. If you're doing, the estrogen hormone therapy, you just need to do it exactly with the same way, with the same days and the same doses.
Okay, thank you. And I can see that Sandra has asked also about how much does the ER map cost?
Thank you very much, Sandra. I do not know any data about this kind, the cost of the test, but of course, my colleagues can answer your questions.
Sure, of course, and we will be able to check it for you. Okay. If you could just also get back to us via patient@eggdonationfriends.com, we will forward this to the clinic and get some answers. Okay. Let's wait. We will be slowly finishing, but I do see someone is typing, so let's take a look. Yeah, okay, I can see that here. Can the transfer be postponed today after if the ER test is not good?
Thank you, Elena, for your question. So, as I already said, the endometrium receptivity test needs to be realized in a cycle before doing the transfer. So, we will have the result and we will go in another cycle directly for the transfer. So then we do not need to, to change our strategy. So if the result of the biopsy says that the endometrium is receptive, then we can just realize the same cycle and go for the transfer. By contrast, if the endometrium is not good, is not with the receptivity, depending on how the class is the window, we should go for another biopsy before doing the transfer to be sure when we should do the transfer.
Okay, perfect. Thank you. I do see we have another question. And Erin, if you could just get back to us with the question one more time, okay? I would appreciate it. I do not see the question, I guess. Let me have a look. Yeah, we have one more here from Sabine. The anti-Mullerian hormone, how important is that parameter for you in terms of deciding if a stimulation would make sense?
Thank you very much, Sabine. Again, so the anti-Mullerian hormone is a predictor of quantity, not quality. So it is most important, and also, to take into account the age of the women. So not only the anti-Mullerian, but also the age needs to be important to take the decision if the stimulation is, is going to make sense or not. But I would say it's with the anti-Mullerian hormone only, we cannot decline.
Okay, perfect. Thank you. And let me have a look. Okay, I believe there is one more question. However, just give me a second. From Erin. Let me just read out to you, okay? Because somehow I am not able to publish it, although I see it in the chat section. So here it comes. Just a second. Oh, yeah. From Erin. I was told by a gynecologist that the endometrial receptivity test is only correct in the month that it is performed. Therefore, he did not recommend it. What is your professional opinion on that? That was after 2 failures.
So can you just repeat, Caroline,
yes,
please?
Yes, of course. I was told by my gynecologist that the endometrial receptivity test is only correct in the month that it is performed. Therefore, he did not recommend. What is your What is your professional opinion?
So my professional opinion, which is, regarding the literature and the researches, is that we understand that if the endometrium is okay, when the biopsy is done in a hormone therapy replacement transfer, then we can truly understand that we can repeat this type of treatment, and we should understand that the endometrium is okay.
Okay, perfect. Thank you. And I believe we have one last question from Sandra. Okay, let's have a look. Just one more question. Do you consider the endometrial microinflammation a problem to be cured with antibiotics, 10 days of doxycycline, or not? Some doctors cure it, some say it has no influence on the implantation.
So now it is also an issue very important to consider the microbiota and the possible, infections in the endometrium. And also we take into account all this type of tests. And also if antibiotic is needed, we also recommend it, especially in, the miscarriage or, sorry, the implantation failure patients before another embryo transfer.
Okay, perfect. Thank you. And I believe that was our last question. So thank you everyone for your time and all of your questions. And of course, Dr. Laura for providing us all the answers and presenting everything to us so clearly. All right, I guess I would like to also ask you if you would like to, Dr. Laura, of course, if you would like to add anything.
Thank you very much.
All right, perfect. Thank you. And also, of course, everyone, I would like to remind you that if you have any questions, you can still forward them to patient@eggdonationfriends.com, and we can again forward this to the clinic, to Dr. Laura as well. And if any of you has any problems with finding a suitable clinic, remember we can also help you. Me and Elizabeth are doing our best to provide all necessary information. So you will be able to find us on our chat, or you can also call us, email us, or whatever is convenient for you. And of course, I would like to thank you for coming and joining our webinar. I would also like to invite you for our next webinar next week, actually. And of course, you can register for the next webinar. It is already published. And I guess that will be all. Hope you had some interesting answers and it will be helpful for you. So thank you, everyone, and I wish you a very good night. Thank you.
Thank you. Bye-bye.
Bye-bye. Bye.